2016 Organizing Committee. It gives me great pleasure to welcome all of you to the 4th International Conference on Pediatrics and Pediatric Emergency Medicine. It's hosted by Omics International today, and I just have a few words for Omics that they asked me to pass along to you. Omics is a committed open access publisher, as probably all of you know. It's an event organizer, and probably many of us have been to conferences hosted by them previously. They work in the field of science and technology, established with a view to accelerate scientific discovery through innovation and knowledge dissemination via scientific associations and meaningful collaborations. Omics International, as a publisher, is committed to the mission of open access and provides easy and free access to the information related to sciences and technology for academic and research purposes. Omics International publishes over 700 peer-reviewed journals in the fields of clinical medicine, pharmacy, management, engineering, technology, and life sciences. And they are publishing over 75,000 articles per year, so chances are you're frequently reading some of their hosted publications. Journals from Omics provide a great scope for knowledge sharing and knowledge transfer with the help of articles indexed in popular medical and science indexes. The research articles published in Omics International journals are deposited in the archives for retrieving, copying, and redistribution. Omics International promotes hassle-free flow of information for research and development activities. Omics International was established in 2008 and has emerged as a major science event organizer globally. It organizes over 600 conferences, 1,200 plus symposiums, and as many workshops across the globe in medical, engineering, clinical, pharmaceutical management, and life science, covering a wide variety of topics. Omics International conferences serve as a meeting point for academic, corporate, and government bodies, and over 99% of academic institutions send their members to Omics conferences. They provide ample opportunities for networking and collaborations. This conference has been initiated with valuable suggestions and constant encouragement from the Omics Group Pediatrics and Therapeutics Journal, which deals with the medical care of infants, children, and adolescents. This conference seeks to provide 3 days of robust discussion on methods, strategies related to diagnosis, prevention, and management of pediatric diseases. Omics also hopes that we'll be able to explore new ideas and concepts at a global scale on major pediatric topics, including neonatology, pediatric immunology, pediatric hematology and oncology, pediatric allergy, pediatric cardiology, pediatric neurology, psychology, and pediatric emergencies. This year's theme of the conference is New Emerging Trends and Research Strategies to Cure Pediatric Diseases. And the guests that I'm going to have step up here in a minute will all be speaking very briefly on that topic. We aim to bring together leading academic scientists, research scholars, student communities, and industrial delegates to exchange and share their experiences and results about all major aspects of pediatric research. Finally, the conference also provides a platform for researchers, scholars, students, and educators to present and discuss the most recent innovations, trends, concerns, and practical challenges encountered and the solutions adapted to the field of pediatric research and treatment. I'd like to thank all the speakers, delegates, and students for their continuous support and patronage. And Omics International wishes to thank all of their staff, including their editorial board and organizers who have worked tirelessly to bring this meeting together. Omics International staff and the program committee have put long hours and a lot of creative input into making this conference happen. Finally, we thank every one of you for coming and participating in this conference, and welcome. So we're going to start. I'm going to start by having a few honored guests join me up on the dais, and each one of them is going to take just a minute to speak about the theme of the conference. So if I could have Dr. Alejandro Bernstein come up and join me here. Dr. Bernstein is a professor of neurosurgery, radiology, and pediatrics, and director of the Hyman Newman Institute for Neurology and Neurosurgery at Mount Sinai Health System in New York City. He's a pioneer in the field of endovascular surgery and established the first comprehensive center for the multidisciplinary treatment of head, neck, and peripheral vascular lesions. His contributions extend from the description of the functional vascular anatomy understanding and describing the diseases, to the development of multiple medical devices to treat them used throughout the world. He's authored over 150 publications in peer-reviewed journals, more than 25 chapters in the field, 9 books including the 5-volume surgical neuroangiography. He's also won numerous awards, including, but not limited to, the Physician of the Year from the Vascular Birthmark Foundation for his work with children with vascular defects, and Boston Scientific Neurovascular Lifetime Achievement Award for Excellence in Research. He also won the Heart of New York Stroke Spotlight Award from the American Heart and Stroke Association. He has been visiting professor, lecturer, and faculty in over 600 occasions. He became the first president of the World Federation of Interventional and Therapeutic Neuroradiology and third president of the American Society of Interventional and Therapeutic Neuroradiology, and has been the president of CYLON, the Latin American Society for Neuroradiology, for 2012 and 2013. So welcome, Dr. Bernstein. I'm going to have everyone join me up here, and then we'll have you each come up in just a second. So please have a seat. There you go. If I could have Dr. Dosh join me up here as well. Dr. Michael Dosh. Dr. Dosh received all of his schooling and training in West Germany, graduating with an MD PhD degree in 1970 from Philipps University in Marburg. In 1974, he began postdoctoral training at Toronto University, Canada, joined the faculty in 1977, and was promoted to full professor of pediatrics and immunology. His core interest is in molecular and cellular elements of type 1 diabetes, documented in over 500 high-profile articles. Could I also have Dr. Samir Balas join me up here? Dr. Balas received his MD with distinction from the American University of Beirut, Lebanon in 1967. He completed his training in hematology at Thomas Jefferson University in Philadelphia, Pennsylvania. He is board certified in internal medicine, hematology, blood banking, pain medicine, and pain management. He is currently Emeritus Professor of Medicine and Pediatrics at Thomas Jefferson University and honorary staff member of Homorio, the Hematology Institute in Rio de Janeiro, Brazil. He has authored or co-authored over 800 articles, book chapters, and abstracts. He also published 2 editions of a book on sickle cell pain in 1998 and 2014, respectively. So welcome, Dr. Balas, and have a seat. If I could have Dr. Petropoulos also join us up on the dais. Dr. Petropoulos graduated from Aristotle University's Medical School, Greece, in 1989. He followed with a 30-year career as a medical officer and senior flight surgeon at the Hellenic Air Force. He specialized in aviation and hyperbaric medicine, pediatrics, fetal medicine, congenital cardiology in the USA and in Europe. He holds a master's in science and preventative cardiology. He is an AEPC Prevention in Heart Failure and Pulmonary Hypertension Working Group member. He worked and lectured in Athens and Brussels universities, and he currently consults in fetal medicine, pediatrics, and congenital cardiology at Marchesi Clinica and is associate professor at the State University and postgraduate center. And then finally, myself, as I said before, I'm Gwenyth Fischer. I'm a pediatric critical care physician at the University of Minnesota at Masonic Children's Hospital in Minnesota. I am also the founder and director of the Pediatric Device Innovation Consortium, of which I will be telling you about later this morning. I also serve as the clinical advisor for the University of Minnesota Medical Device Center, pediatric ECMO director at Masonic Children's Hospital, and cardiopulmonary director at Masonic Children's Hospital. I've disclosed over 25 inventions to our university, several in the pediatric space, and my research interests are in the area of design, development, testing, and regulation of pediatric-specific technologies, all of which I will tell you much more about later. So thank you.